We're going to talk about carpal tunnel today and take a few minutes and go over some things. I'm Dr. Walsh from over here at Walsh Chiropractic in physical therapy in Hagerstown. Been here in town for about 7 years. Opened up my clinic in 2020. And you see this a lot. Everybody knows somebody who's had carpal tunnel or what's been diagnosed as carpal tunnel. And a lot of us have known a number of people with carpal tunnel surgery. And out of those people that we knew, we also know people that had the surgery and they didn't improve. So you got a lot of things going on in here. And you got to understand the foot and the hand, they're arched like this. So the connective tissue above it and the space under that arch make up the carpal tunnel. So you got things going through it. You've got finger flexors, ligaments that go underneath there, and you've got the median nerve. So what happens is in a normal carpal tunnel, you've got room. In one that isn't, the connective tissue is compressing onto the medial nerve, which then can present as pain, pins and needles, numbness in the hand. Now, I've seen a lot of patients have it, and I'm going to be honest with you, I have not seen a lot of patients that had the surgery that had success. So what does that tell you? It wasn't coming from the carpal tunnel. A lot of times what happens is all the nerves that go down to the fingertips come out from the lower cervical and upper two thoracic nerves. And it's not the full spinal nerve that comes down. It's branches of those, just like the sciatic nerve. It's branches of those that make up all the nerves that come in, do the three functions, right? So you have sensory, which is pain, pins and needles, numbness, proprioception, those are all sensory, pressure, temperature, muscle, and autonomics. Autonomics in the arm, the hand, aren't a lot to open up arterial diameters for an exercise to allow more blood, allow more oxygen to the cells. And sweat glands is another one. Those are the automatic functions of the autonomic system. So clinically, when I see somebody with carpal tunnel, they've had surgery and sometimes multiple surgeries and it hasn't improved, I typically go to the cervicals. You either go to the cervicals or to the pathway in which the nerves follow. And there are different plexuses in the upper arm, shoulder that you can work. But typically what you want to do with that is, number one, can be hand position, especially as we get older. Extension of the wrist closes down that carpal tunnel because when you extend, you send one of the wrist bones down to take up space in that tunnel, right? So it's going to take up space. You got to watch extension. Hand position, a lot of people don't ergonomically have their workstation set up, right? And actually the workstation should be set up to where the elbows are in and the wrists are what's called a gentle waterfall. But mostly people have their keyboards up to where their wrists are extended. Now imagine you're on the computer all day long, 5 days a week at least, and at home some, year after year after year. So you can develop some issues with impeding on the carpal tunnel. But when I see patients that have had this and have had surgery on both or single or multiple surgery on the same wrist and nothing improves or they came back, it was good for a while, they came back, then you got to look at some other things. Number one, if it was good for a little while, then what were you doing to make it bad again? Did you go back doing the same thing? Did you set up your workstation ergonomically? What are you doing with your hands? The other thing is it might not be coming from the hands. It might not be coming from the carpal tunnel. So what you got to do is then we got to do an examination of the neck and orthopedic tests, things like that. Once we find something that could be contributing, such as subluxations in the spine, especially the cervical spine, upper thoracic, then what we will do is we'll adjust and then we will do different soft tissue there and we'll do some stim, some heat, some stretching, some posture analysis, and maybe posture correction. And that's another thing too, right? Because that can contribute. Whether it's coming from the wrist or even from the neck, when you're on the computer, typically you're in a bad position. So it can be a combination of different things. But basically that's it. And I think everybody knows people that have had the surgery, and I think everybody knows somebody that's had the surgery and it wasn't successful. So that's typically what we treat. That is kind of a common one we can help out with. And it's pretty quick, depending upon the severity. It can be pretty quick. But that's carpal tunnel in a heartbeat.